Yeah, I think that you've got to be creative about how we recruit anymore and what differentiates you, right, as a health system or as a hospital. And no longer are the days where you can expect us to post a job and have all these people apply to your job and people waiting at the door. And so we're trying to create programs here at Bon Secours that attract candidates that differentiate us from others. We have a nurse residency program is not unique to Bon Secours, but how do we make it unique to where we can advertise it as doing something a little bit differently for new graduate nurses? We've got a program here where we do an accelerated pathway where we allow nursing new graduates to come in, and over a period of 10 to 12 weeks, they rotate between different units so they can really see what works for them. And we have found that has been highly successful in retaining nurses and getting them into the unit that they feel most supported in and that they feel most at home in. And so, yes, it is something that's financially we're taking, having to take a step back and say, we're willing to, give you 10 weeks of that orientation to see all these different units to say, what is the right pick for you? And, since we've been doing that and really listening to the workforce, we've just had remarkable success getting people to the right units. And from a retention standpoint, the turnover has decreased. So you're creating that culture that you're really striving to get to take the best care of our patients. And so being that differentiator, I think, is really important right now in healthcare to recruiting, but also you talked about culture earlier and creating a culture where people really want to come to work and they feel like they're supported at work, and trying to make sure that leadership is visible to them, that they know the why behind the what. All of those things I think are really important to getting the culture that's going to get the nurses to be recruited to you. And again, then compensation doesn't feel so important, that dollar an hour extra, when you have a place that you truly enjoy coming to work and feel supported by your leaders. So I think that's what, for me, it boils down to, is creating a culture of nursing where they truly understand their value in their role and truly feel supported by us as leaders.